Assalamu alaikum warahmatullahi wabarakatuh. The effect of systemic statin intake on healing of apical periodontitis after non-surgical root canal treatment. A retrospective cohort study done by a group from King's College University, published in GOE in 2025. While bacteria are the main cause of apical periodontitis, healing also depends on the host systemic condition, can impair bone regeneration and prolong inflammation, delaying recovery even after well-performed treatment. Several studies have suggested that adjunct pharmacological therapy, whether locally administered as intracranial medications or systematically, may potentially enhance the healing of apical periodontitis. In particular, regular statin intake has been linked to improve apical periodontitis healing. There is limited literature exploring the association between statins and healing of apical periodontitis following endodontic therapy. So this study aimed to assess whether systematic statin use improves radiographic healing of apical periodontitis after non-surgical root canal treatment or retreatment. Patients who received non-surgical root canal treatment or retreatment between 2009 and 2021 were evaluated. Inclusion required patients aged 35 years old with at least 1 year follow-up radiographs. Patients were divided into two age-matched groups, those taking systemic statins and those who never used them. Data were extracted included demographics, medical history, tooth type, procedure type, root filling and restoration quality, and statin use. Periapical radiographs were evaluated by two calibrated blinded examiners. Healing was scored using a 6-point scale developed by Patel et al. In 2012, then categorized into lenient criteria, which is scores between 4 and 6, and strict criteria, scores 5 and 6. Fillings were considered adequate if dense, tapered, and 0.5 to 2 mm from the apex. The final sample included 122 teeth from 108 patients. The study included 122 teeth, 62 for statin and 60 for control, with a mean age of 61 years. Groups were similar in age, gender, smoking, presence of apical periodontitis, and follow-up duration. Most teeth received primary non-surgical root canal treatment, with only 10 retreatment equally distributed. Molars were more common in the control group. Using lenient healing criteria, both groups showed a similar success rate, for statin 90% and control group 90%. The only significant factor was the presence of voids in the root filling. However, with the strict criteria, complete healing was significantly lower in the statin group, with 62% compared to control, which had 85%. Apical periodontitis presence strongly reduced healing, while longer follow-up increased healing probability. So we can conclude that systemic statin use was associated with reduced complete radiographic healing of apical periodontitis after root canal treatment. This challenges previous assumption about the potential benefits of statins in enhancing periapical healing. Further prospective studies is necessary to understand the potential impact of statins on periapical healing.